Hello, and welcome to this edition of Ask the Doctor. Our associate producer, Adam Gerber, brought to my attention that when we were talking about the Affordable Care Act in our earlier recording, I made the same mistake that Bernie Sanders made. So I'm here to make recompense. Basically, health insurance comes with premiums and deductibles. Medicare for all would come with a tax. And the amount of the tax would probably be in the neighborhood of a couple $1,000s or so a year for a family. Now, the reality is the amount of increase in one's tax would be less than what most people are spending for their deductible now. That's point one. Point two, the insurance premiums would go away. By not having a deductible and by not having an insurance premium, the savings for Medicare for all would be far greater than the increase in the amount of the tax. Now, the politicians did a poor job of explaining that, and I did a poor job of explaining it in our previous recording. So I want to make it clear that if that's what they meant to say, and the implication is that's what their intention was, then they should have done a better job, like I should have done a better job, of explaining that deductibles and premiums go away, but yes, the tax does increase. Now, the other point that I failed to make in that recording was when people make their living building insurance companies, essentially they've mastered the art of telling a lie. Because when you accurately diagnose stuff that's common, the shrewd Wall Street types that decide what's covered aren't going to cover it, all right? So you have to call it something else so it will be covered. And what's amazing to me is they even have college degrees now. People go to college to learn how to do insurance billing. And what they're really learning is how to tell a lie so insurance will cover whatever it is you're trying to get paid for. And that concept is one that will go away if we had Medicare for all. We wouldn't have to do anything but bill for the service that was provided, get paid whatever the government says you're going to pay. And if it's not enough, you pay privately, and then that's the end of that conversation. So the reality is letting the Wall Street people decide what we should be getting in the way of coverage, or looking out for the interests of the pharmaceutical industry, or looking out for the interests of the insurance industry. The insurance industry got 30 million new customers with Obamacare. And basically, that reality is good for them, but it wasn't good for anybody else, because when they removed the mandate and no longer made it required for everybody to participate, all of a sudden, all these people who were gobbling up the new customers went out of the business. And in some states, they have fewer than 2 providers who are willing to work under the terms and conditions of the Obamacare. So now that Obamacare is about to go the way of the dodo bird, basically that doesn't matter anymore. But the reality is what we replace it with, or however we improve it, needs to take into consideration some of these very basic concepts. Thank you for your attention, and I appreciate Adam Gerber for bringing it to my attention that I didn't do any better than Bernie Sanders in explaining why Medicare for all is better than what we have now. Thank you.
Thank you for listening to the Wise Medical Minute with Dr. Thomas Locke. Dr. Locke addresses current events as well as important medical issues using responsible, unbiased journalism approached from a medical perspective. We invite you to submit questions or comments or suggestions for future topics by email to info@wisemedicalcenter.com. Again, thank you for viewing the Wise Medical Minute.